Hello and welcome, it's Dr.sun. Today I'm going to talk about the obesity complications. Let's get into it. So before going to start, I need to talk about the obesity a little bit. So what is obesity? Obesity is a medical condition in which the excess body fat has accumulated to an extent that it may have a negative effect on health. It's really important. People are generally considered obese when their body mass index, means we call it BMI, is increased. So it's really important for us to understand about the obesity and obesity related complications. Now if we think about the BMI ranges 18 to 24, it is the normal range. 25 to 29, it is overweight. If it is more than 30, we call it obese. Obese again we classify into class 1, class 2 and class 3. Let's talk about the obesity complications. Under the obesity complications we have psychosocial. In the psychosocial we have eating disorder, social isolation and depression. Now talk about the pulmonary, means our lungs problem. Exercise intolerance, obstructive sleep apnea and asthma. It's really important to understand. Next is gastrointestinal. Yes, we are talking about our GI system. Gallstones, gastroesophageal reflux disease, non-alcoholic fatty liver disease is really important, and colon cancer. Next is renal, means we are talking about our kidney system. Glomerulosclerosis, renal cancer. Okay, next is musculoskeletal, ankle sprains, flat feet, tibia, vera, osteoarthritis and also back pain. Next is neurological, means we are talking about our nervous system or brain. Idiopathic intracranial hypertension, it's really important. Next is cardiovascular or our CV system. Hypertension, dyslipidemia, coagulopathy, chronic inflammation and endothelial dysfunction. All these consequences, neurological and the cardiovascular system, it's all are important and you should be careful about it. Now let's talk about our most important endocrine system. Insulin resistance, impaired fasting glucose, glucose intolerance, type 2 diabetes, precocious puberty, menstrual irregularities, polycystic ovary syndrome and also hormone-related cancers. Next, we talk about the relative risk for cardiovascular disease. If you see the graph, then you can easily understand if the BMI is less than 21, it is less cardiovascular risk, and if it is more than 29, it is increased cardiovascular risk. And next, we talk about the relative risk for type 2 diabetes. If the BMI is less than 25, then less diabetic risk, and if it is more than 30, increased diabetic, means the type 2 diabetes risk. Now let's talk about the potentially reversible causes of weight gain. We have endocrine factors and the drug treatments. Under the endocrine factors we have hypothyroidism, Cushing syndrome, insulinoma and hypothalamic tumors or injury. Next is under the drug treatments we have atypical antipsychotics, sulfonylureas, insulin, pizotufan, glucocorticoids, sodium valproate and also beta blocker. So finally, from the above discussion you can easily understand these all the consequences of obesity complications, and obesity complications are really important. And if you have any kind of obesity related complications, you should talk to your doctor and treat them well. So that's all for today. Thanks for staying with us and have a great day.